Welcome. Today, we're diving into a complex and challenging neurological disorder known as multiple system atrophy, or MSA. This rare condition affects multiple systems in the body, leading to progressive loss of motor control, autonomic functions, and overall quality of life. Join us as we explore its causes, symptoms, diagnosis, and the ongoing search for effective treatments. The exact cause of MSA remains a mystery, but researchers believe it involves a complex interplay of genetic and environmental factors. Unlike some other neurodegenerative diseases, MSA is generally considered non-hereditary, meaning it's unlikely to be passed down directly from parents to children. However, subtle genetic predispositions may increase susceptibility in some individuals. Current research focuses on identifying potential environmental triggers and genetic variants that may contribute to the development of this debilitating condition. Specific proteins and cellular pathways are also being investigated for their role in the disease process. At the heart of MSA lies the progressive degeneration of nerve cells in several areas of the brain and spinal cord. Specifically, this affects regions that control movement, balance, and autonomic functions like blood pressure, heart rate, bowel and bladder control, and sweating. A key hallmark of MSA is the abnormal accumulation of a protein called alpha-synuclein within glial cells, support cells in the brain. These alpha-synuclein deposits, known as glial cytoplasmic inclusions, disrupt the normal function of these cells and lead to neuronal damage and cell death. The affected brain regions include the cerebellum, basal ganglia, and brainstem, each responsible for different aspects of motor and autonomic control. This widespread damage leads to the diverse and overlapping symptoms characteristic of MSA. MSA is a rare disorder, affecting an estimated 3 to 5 people per 100,000. It typically develops in adulthood, usually between the ages of 50 and 60. There is no known geographic, ethnic, or racial predisposition to MSA, while it can affect both men and women. Some studies suggest a slightly higher prevalence in men, due to its rarity and the similarity of its early symptoms to those of other neurological disorders like Parkinson's disease. MSA is often misdiagnosed, which can delay appropriate treatment and management. The signs and symptoms of MSA are varied and can differ from person to person, depending on the specific areas of the brain affected. Motor symptoms often include slowness of movement, rigidity, tremors, and poor coordination, resembling Parkinson's disease. However, MSA progresses more rapidly than Parkinson's. Cerebellar dysfunction can manifest as problems with balance and coordination, leading to frequent falls, slurred speech, and difficulty swallowing. Autonomic dysfunction is a hallmark of MSA, leading to symptoms like orthostatic hypotension, a drop in blood pressure upon standing, bladder and bowel control problems, erectile dysfunction, and difficulties with sweating and temperature regulation. Other possible symptoms include sleep disturbances, such as REM sleep behavior disorder and breathing difficulties, especially during sleep. Diagnosing MSA can be challenging, especially in the early stages. There is no single definitive test for the disease. Diagnosis relies on a thorough neurological examination, a detailed medical history, and the exclusion of other conditions with similar symptoms. Brain imaging techniques, such as MRI, can help identify specific patterns of brain atrophy that are characteristic of MSA. Autonomic function tests, like tilt table testing and blood pressure monitoring, can assess the severity of autonomic dysfunction. Genetic testing can rule out other, rarer genetic forms of Parkinsonism. In some cases, a definitive diagnosis can only be confirmed after death through neuropathological examination of the brain. MSA is broadly classified into two main types based on the predominant symptoms: MSAP, where Parkinsonian features like slowness, rigidity, and tremor are dominant, and MSAC, where cerebellar features like ataxia, poor coordination, imbalance, and slurred speech are more prominent. Some individuals may exhibit a mix of both Parkinsonian and cerebellar symptoms. Recognizing these subtypes can help guide treatment strategies and anticipate potential complications. Currently, there is no cure for MSA, and treatment focuses on managing symptoms and improving quality of life. Medications used to treat Parkinson's disease may provide some relief from motor symptoms, but their effectiveness is often limited in MSA. Non-pharmacological therapies play a crucial role in managing symptoms. Physical therapy can help maintain mobility, strength, and balance. Occupational therapy can assist with adapting daily activities to compensate for physical limitations. Speech therapy can address swallowing and speech difficulties. Supportive measures for autonomic dysfunction include medications to raise blood pressure, dietary modifications to increase fluid and salt intake, and strategies to manage bladder and bowel problems. Assistive devices, such as walkers and wheelchairs, may become necessary as the disease progresses. Because the exact cause of MSA is unknown, there are currently no proven preventive measures. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and avoiding toxins, may promote overall brain health, but there's no evidence to suggest that these measures can prevent MSA specifically. Research into potential environmental and genetic risk factors may eventually lead to targeted preventive strategies in the future. MSA is a progressive and ultimately fatal disease. The prognosis varies depending on the individual, but the average survival time after diagnosis is approximately 6 to 10 years. Recent research is focused on understanding the underlying mechanisms of MSA and identifying potential therapeutic targets. Studies are exploring the role of inflammation, oxidative stress, and protein aggregation in the disease process. Clinical trials are underway to evaluate new medications and therapies that may slow disease progression or alleviate symptoms. These include potential neuroprotective agents, immunotherapy approaches, and gene therapy strategies. While a cure remains elusive, ongoing research offers hope for improved treatments and a better future for individuals living with MSA.